For. We are talking about the heart valves and how a buildup of calcium can impact how they operate. An advanced procedure at Beacon that only takes a few hours is getting patients back to their normal lives within days. Al Cover is walking and exercising again the way he was a few years ago.
And in my work, my partners recognize the increase, my energy again, too.
The now 62-year-old recalls a growing but not severe shortness of breath.
It was just more, activity level just kept decreasing.
An ultrasound revealed aortic valve stenosis, a calcification that builds up on the valve, restricts its movement, and eventually slows the blood flow through the heart. Dr. Walter Halloran, a cardiothoracic surgeon at Beacon Medical Group who performed Al's surgery, says the diagnosis couldn't have come soon enough.
It has a worse prognosis than almost any cancer. It has about a 50% per 18 to 24 months mortality. It's a very lethal disease.
Genetics also played a role in Al's case, having been born with a 2-leaflet valve instead of a 3, common in about 20% of patients Elkhart General treats. Dr. Halloran says most people born with a 2-leaflet valve will develop dysfunction in their life, but at what age is hard to tell. A minimally invasive procedure to repair or replace the valve fixed through the sternum or small incision was recommended in Al's case. This type of procedure results in usually less than a day in the hospital and a faster recovery at home.
They get out of the hospital a bit sooner, but the big thing is they can return to normal activity in about a week and a half or 2 weeks.
Common symptoms of aortic valve stenosis include chest pain, fainting spells, a drop in blood pressure, and neurologic symptoms. All things Dr. Halloran says if you experience, you shouldn't put off getting checked out by a doctor. As for Al, he's noticed more men in his life ask about the procedure after his surgery at Elkhart General and is more than happy to spread awareness about it.
Everybody was so competent, so confident, and compassionate. It was remarkable, actually.
Al says because he was born with this specific type of valve, it's inspired others in his family to get checked for it too. If you're curious about learning more on the procedure or the warning signs, we've posted the full interview with Dr. Halloran on the WSBT YouTube page. In the studio, Aaron Leedy, WSBT.